record?
Yeah, it's working.
Oh, it's good. So it's recording your side, yeah?
Oh, no, I mean, like, you just showed up, like, yours is working, like, mine's didn't.
Yeah. Because now it's just started recording, yeah. Okay, good. Is this big enough for you, or should we make it bigger?
This is fine.
It's fine, good. Oh, that's good.
Yeah.
Yeah, we have, we looked at the renal last time, but yeah, we have the progression of carcinoma. And remember last time I said that the body tries to attempt to isolate the cancer, the tumor, by growing or developing lots of fibrous tissue, and you can see this mass of fibrous tissue here. The carcinoma is this mass on the upper left hand side, a lot of disruptive cell division, abnormal cell division, if you like. Whereas if we go to the bottom right hand side, we can still see some examples of fairly normal glomeruli with a regular Bowman's capsule, and of course the diffusible membrane looks pretty intact. But as we get closer to the tumor, you can see the degradation or the collapse of the glomeruli. So this is an invasive, it's invasive, this tumor is invasive into the tissue. It's destroying the normal function of the tissue. It compresses the renal tissue, in other words. Okay, good. It'll be interesting if we can see in the magnification some accumulation of fat droplets, because this can also occur in the kidney. Here's a very good slide of the attempt to isolate the tumor, and that the fibrous tissue is massive around it. There's a distinct border as well. I can see that. Within the mass of the tumor, there's spots of degradation into what we call necrotic tissue. So all the dark spots there is necrosis. And as the tumor grows in size, eventually the central bit starts to necrose. And that causes all sorts of problems with tissue and organ function as well. Apart from that, I think the fibrous tissue is also disrupting the rest of the kidney function by compressing the tubules. A lot of tubules here are being compressed by the fibrous tissue as this tumor grows in size. Remember as well, it's highly vascularized, the kidney is, and so the carcinoma is likely to spread within the bloodstream. Okay. Here's a very, very good slide indeed. Good cellular detail of the compressed nature of the tumor. And here we can see how packed the cells are, and the nuclei are evident in certain cases, but the cells are of abnormal size and shape, and they are dividing, but in an abnormal way, as is the characteristic of a tumor. The spaces forming within the tissue are interesting as well. Fairly clear cytoplasmic spaces, as you can see there. Almost looks like the tumor has holes in it, but it's kind of like clear cytoplasmic areas. Because as the tumor is rapidly dividing, so there's less ability or chance for development of cellular structures, if you like, inside the cells. The cancerous cell doesn't do that as such. It rather divides its mass and obtains its nutrients from surrounding tissue. The fibers here are well developed, very, very well developed, strand-like, and supported by dividing tissue or nuclei that are adding protein to the fibrous mass. This space here is a fluid-filled space in between the fibers and the tumor. The carcinoma, again, as we can see, massive abnormal cell division. empty or clear cytoplasm, as I said before, the cells of the tumor derive their nutrients from the normal healthy tissue outside its mass. And what a tumor does have, though, is a lot of blood supply to it in order to gain those nutrients. So if we did another slide or stain, we could probably see quite a lot of the blood vessels. Not so clear here in this particular H&E section. Transitional cell urethral carcinoma. What's interesting is the border of the progression or the growth of the carcinoma. It's quite rough, if you like, and it indicates it's rapidly dividing, progressive, growing rapidly. And it's kind of like finger-like projections, if you like. And your lecture talks about fibrovascular cores. There's a lot of hardening in the tumor itself. It becomes a hard structure, and the fiber adds in the central bit here. There's fibrovascular areas here. There's some fiber there developing. A lot of fiber here, so that the purpley bits, darker purpley bits, is the fiber. Lined by a thick urothelium. The urothelial tissue is more this thick band of tissue surrounding the fibers. It's dividing, but in an abnormal way, if you like, and this helps the tumor invade normal healthy tissue. Okay. Now we can see this, as I said, the dividing tissue. This is the dividing tissue, the urothelium, and the merging effects of this projection growing out. These cells are highly abnormal. They don't look uniform at all. A lot of fibrous tissue being deposited as the finger-like or papillary structures start to grow and spread. Okay. He says quite correctly, nuclear atypical. Yes, so abnormal nuclear division, abnormal nucleolar shapes as well. The nuclei, some are round, some are elongated. A total abnormal cell division there. However, at the far right extreme, we have some normal nuclei, the round ones there. Those are more normal. Okay. Prostatic carcinoma. This is a slow-growing cancer, less invasive, if you like. Can take 13, 15 years to become nasty to the person. It tends to start its life as a damage to the dividing cells, the mitotic cells, and that could be due to virus, could be due to cigarettes, some indication of nicotine, could be due to bacterial infection of the prostate gland. The prostate gland tends to be a gland that's surrounded by a capsule, which you can see the capsule here. The cancer then develops in little pockets inside the gland, roundish pockets, sort of localized areas in the gland. And this is why it takes a bit of a while to spread as such. Because most men, by the time they reach 85 years old, have some of these round pockets as a consequence of aging, but they never turn carcinogenic. Something has to trigger that. The rough fibrovascular stroma. The rough stroma is the rough edges to the pockets within the tissue. Now we can see in the magnified version the rough edges to the pocket of tissue. A lot of fat accumulation, fat droplets are forming as a result of the disrupted metabolism. Some of the normal cells we can still see in the prostatic tissue there. The seborrheic glandular structures can be seen as well. And if we look for some of those, sort of this area here, seborrheic glandular structures are forming, and these kind of like are linked to the action of the carcinogenic cells. There's a slight disruption to the fluid production, if you like, from the prostate gland, which supplies nutrients for the spermatozoa, so there's less nutrient material produced. The nutrients would tend to run in these channels and then eventually exit into the top of the urethra of the man. The gland tends to become, with time, with progression, tends to become harder and rougher. When the doctor feels it through the rectum, he can feel it's rough and hard. And the hardening of the tissue tends to be as a consequence of proliferation. Lots of pockets here are proliferating. These areas here in the center, eventually these grow in size and harden the gland. Okay. The hardening is probably related to the death of certain cells and their replacement by fibrous tissue. In this slide, we have benign prostatic glands with double-layered epithelium. Benign, no cancer as yet, but probably hyperplasia. Now, hyperplasia is with age in a man, the prostate glands begins to grow in size. It doesn't mean to say it's carcinogenic or cancerous, but because it's growing in size, it means the spaces within it are growing in size. So as the lumens, which carry fluid, increase in size, so the gland increases in size. It's still perfectly normal until a trigger happens whereby the dividing tissue transfers itself or changes into carcinogen. Looking at this, it's fairly normal cell division happening. I can see a good structure of tissue there around this lumen. The cells are uniform, no example of carcinogenic change. Tuberculosis of the testis, jumping. This is tends to be as a consequence of a number of things. It could be a form of bacterial infection, it could be aging, it could be kidney problem as well. Some kidney problem with a lot of calcium accumulation, can be thyroid problem as well. Caseous necrosis, yeah, death. So wherever you're looking at cases, you're thinking of calcium deposits. Necrosis is spread throughout all the dark patches here. Dark patches is necrotic tissue. There's some bits of here as well forming. Notice how the testis tries to localize them with fiber. So the testis becomes all lobular or noduled, if you like. Lobular nodule testis. Tuberculomata are sometimes the phrase is used for the lobules or the nodules that form within the testis. Here's the good magnification. The caseous necrosis in the center, necrotic death in the center of the the calcium deposit or nodule. These tubules here, structures, tend to look fairly normal. Here, okay, these are going to produce the spermatozoa, which are going to flood into the channels and be channeled out of the testes. These look pretty normal. The pressure of this, though, is starting to disrupt some of them, pushing on here. Okay, hardening of the structure begins. Not a very clear slide, but just the central death of the granuloma in the center there. Spaces start to form. And the disruption to the tubular network within the testis on the border of the granuloma. These are still normally dividing. Okay, so meiosis is occurring normally there to produce the haploid spermatozoa. Sorry, jump there. A highly magnified version here. Got the central necrotic area, as I was talked about before. But here the attempt is to try and show the lymphocytic invasion and the Langerhans, the macrophage invasion as well. So there's some attempt of the immune system to invade this necrotic tissue, if you like, that's forming. And this is this dark area is dead tissue, necrosis. Okay. But these macrophages are making their way towards the center of the mass, if you like. Right? They will attempt to attack the necrotic tissue as they enter the mass. Epithelioid cells contributing probably towards the deposition of the calcium in the mass. Some attempt to localize the mass with fibrous tissue is there on the right. Okay. There's a lovely magnified slide. You've got the fibrous border around the mass. The macrophages are lovely there, nice detail. Nucleus of the macrophage, nice there. The cells here are becoming disrupted. Why I say that is because there's some droplets forming in the cytoplasm, the round, clear white areas. And that's lipid accumulation, and that causes disruption to meiosis. Fibrous tissue forming, yeah. Epithelioid cells, macrophage migration through the epithelioid matrix towards the center of the granuloma to attempt to isolate the necrosis. Seminoma, uniform tumor cells. When it says uniform, it looks fairly, the cell matrix looks fairly constant, if you like, but there are some lobules that are formed. These globules separated by the darker purple stained areas that are formed, fairly haphazard in the mass. Fibrous septi, fiber is going to also form in between the lobules, so this dark tissue is the fiber, if you like. Some areas of necrosis, blackened areas I can see there towards the center, it's necrotic tissue. Some necrosis there. T lymphocytes would certainly migrate towards the center of this to try and kill the necrotic tissue. You can see one example there of a lymphocyte there. Okay, one example. This is a neutrophil, very good example of a neutrophil there, multi-lobe nucleus. This is the lymphocyte. So neutrophils support the lymphocytic invasion, so the lymphocytes are making their way, trying to look for any macrophages, can't see any as such, but I can see the lymphocyte there. Okay, good. The cells in the mass are large in the seminoma, large dividing cells, haphazard within the lobules, fibrous tissue, as we've just spoken about before. Lots of cytoplasmic material or matter, the large nuclei, clearish sort of cytoplasm, if you like. Some are a bit abnormal, elongated there, not round as they should be. So in this slide, there's a bit of mitosis occurring. However, it's not exactly uniform, if you like. It's not normal. I can't see examples of any white blood cells in this magnified slide, though. Here's a clearer picture of the dividing cells. Round nuclei. Cells tend to be roundish themselves, roundish. Some distinct cell membranes observed as well. You can see the cell membrane there. It's quite good. Irregular nuclei, irregular shapes. The nucleoli aren't that easily seen, but there's one irregular one there. Good one there, normal round, elongated nucleoli. So mitosis is occurring, but in a not so normal fashion, if you like. Here's a better slide of you can see the nucleoli within the nucleolus, should I say, within the nucleus. Okay, good cell membrane, elongated cell membrane there. Fibrous tissue, strands of it, some strands of fibrous tissue. The nucleus is a bit abnormal there. Some elongation. Hopefully what we want is a roundish nucleus. This is normal. There, it's more normal. But overall, this tissue is quite mitotic and would require a lot of energy for that process. Hence the glycogen, the necessity for glycogen. Excuse me. The example here is cervix, cervical erosion. Inflammation is a consequence of excuse me, infection. And the rough border, the sloughing of the tissue occurring along the border is evident. Okay. The transitional zone of the cervix is where the cell division occurs, transition just below the surface, this area here. I can see some examples of necrosis happening over there, necrotic tissue forming there, some there. Okay, so it looks like a damage from an invasive agent, perhaps a virus. Denudation is lack of epithelial lining. So the lining is sloughing away. And you can see examples of debris in the lumen. The invasion, carcinoma of the cervix, is a very good example of the tumor there, the mass of the tumor, and its association with the surface, the epithelial surface, which it has damaged. It's invading deeper into the cervix, finding more of the mitotic tissue from whence it derives its energy. Solid nests of squamous cells are observed. Now let's see if we can find these nests. So the squamous tissue tends to be further up towards the surface. You can see some of the nests out here. These are nests of tissue, some nest there, nests there. infiltrative growth of the tumor. It's infiltrating the dividing tissue by producing projections. In the center we have necrosis in the center of the tumor, as we've seen before, necrotic tissue. The body will attempt to introduce some macrophages to try and destroy that central bit. If keratin pearls in the centers of the nests, the tumor is defined as well differentiated. Basically, if we, within a nest, if we see a hardening mass or keratinous tissue forming, then the tumor is well established. This is a well established one here. And the pearls eventually lead to necrosis, if you like. Fairly disruptive tissue function all over in this slide. So the stromal reaction is disruptive. Desmoplastic reaction of rough collagen. Collagenous protein deposition is occurring. Let's see if we can find some of that. Collagenous mass over there. Collagenous deposition in this area. Yeah. It's going to cause the cervix to harden.
Could you just show the solid nests again?
Okay, no problem. The solid nests, yes. The nests are these are the solid nests there. There's a small one there. There's one here growing. This invasive tumor has grown from a nest, so that's not a nest as such, but there's one. There's one. So basically the nests are starting in the epithelial squamous area of the cervix. Okay.
Okay.
There's another example of a nest there, but it tends to be at the top here. This is just a more magnified area. The solid nests of the squamous cells are towards the top of the slide of the tissue. This is the lumen of the cervix. The nest area is this here. This is the nest area here. And the whole of the epithelium has been changed, if you like. The squamous tissue has also been changed, as something has damaged the dividing cells, probably viral. And what happens is the virus changes the mitotic division into abnormal structures which form nests, and these nests eventually grow into a tumor. The moderate differentiated tissue has become quite evident. So instead of a nice epithelial border, you have a disruptive border. Instead of nice squamous tissue, which you have some patches of, it becomes patchy, if you like. And eventually bits of this are going to break away from the cervix. It's going to break off. So there is some debris in the lumen of the cervix as well. We can see that. Pearls, if keratinous pearls, can't really see the pearls as such. More in the larger tumor that we saw in the previous slide, we saw an example of a pearl. Internal endometriosis of the uterus. You can see there some necrosis happening there. Endometrial disruption of the cell division, if you like, space is forming. Let's just turn this off. Sorry about that. The holes that are forming are a consequence of the endometriosis. Now, endo means internal, endometriosis, disruption to function, loss of function, if you like. And he calls this adenomyosis. This condition is observed usually after preceding pregnancy. Basically the tissue has changed its nature, if you like, in the uterus due to expansion of the uterus. So there is some stretching, if you like, of the uterine tissue. These holes eventually would be replaced by, once birth has happened, these would be all repaired, fixed, okay, by the normal stroma of the uterus. Normal pregnancy in utero. You can see here an example of the villi, decidua. The blood supply is fairly good here into this tissue, the tissue mass. There's some examples there of capillaries and a nice, lovely epithelial tissue, borders, very normal. The villi are lined by double layer of syncytial trophoblasts. Yeah, they are definitely lined there, well lined, to support the growing embryo. Okay. What else does he say? They have loose connective tissue stroma with small blood vessels. Yeah, we've spoken about the blood vessels inside the villi. The decidua are active to progesterone, endometrial stroma with reactive round plump polygonal stromal cells. Yep, so you've got the round stromal cells, round structures there, surrounded by stromal cells. Okay. Over there. And this is going to help eventually with the formation of the placental and blood vessel connections for the growing embryo. All fairly normal, healthy, no example of disruption or abnormal cell division. Decidual reaction in pregnancy. The reaction to progesterone is that there is rapid cell division. I can see normal cells there, normal cell division, stretching of the tissue, growth of the tissue, normal growth happening. There's no real examples of necrosis. A lot of blood supply to this tissue. Polygonal cells. Let's look for some of these polygonal stromal cells. Stroma tends to, these are polygonal cells here. Polygonal cells, okay. They supply nutrients to the growing tissue. Okay, and the aristera glands, glandular tissue. You can find some examples up here, glandular tissue there. So these are the glandular tissues that if you ask you in the exam, these are the glandular areas here. Producing lots of secretions to help with the mucus, for example, will help with the stretching and growth of the uterus. Cytoplasmic vacuolization. A little bit there, you can see some vacuoles forming there in the cytoplasm of some of the cells. Parkinoptic nuclei. There's a parkinoptic nucleus. Parkinoptic means a copy of the nucleus, if you like, so there's one there. So it looks almost as if there are two nuclei in a cell. Parkinoptic. It's just basically the cell division to support the growing uterus that's accommodated the pregnancy. Fairly normal cell division there. The placental villi that are becoming highly vascularized. You can see a very good example of a capillary there, being sectioned, thin-walled, lovely normal border of the cells of the villi. Okay, wonderful stromal cells there as well. Well, a very good slide. The placental villi are lined, very well lined. No abnormal, no necrotic areas. And these are going to progress into the mass of the uterus and develop their more advanced blood supply. That will then allow diffuse materials into the growing uterus. At this stage, we call it the trophoblast. So just the initial stages of development of the villi. This is a jump now to a mole, a nevus, sometimes called. There's a section through a mole, growth of a skin structure. What we've got to look for in such slides is, has it become carcinogenic or not? The slide here indicates there is some necrosis. I can see there. Necrosis, the spots of necrosis. However, the border tends to be fairly normal in this mole, or section of the mole. And here's another part of it. The tissue that's come away with the removed mole looks fairly normal in the skin. This is the skin here. It would be interesting to see a magnified version of this mole to see if it has changed to, is beginning to become carcinogenic. Trophoblastic epithelial proliferation. There is. The epithelial is the growth of the mole. You can see it's fairly uniform. The epithelium is always the surface tissue. Now we can see again the trophoblastic proliferation of the mole. Supportive tissue around the mole. Now, can you see all the blood supply into the mole mass? Lots of blood supply there. Capillary network is massive. Normal skin cells there. This is also part of the mole. You can see some areas of necrosis in the mole. Stromal edema, lack of stromal blood vessels. Stromal edema. Edema is the accumulation of fluid, yes. You can see some edema here. In that center, there's no blood vessels. Whereas in this section, you can see lots of blood vessels. Okay. All right. What are we doing? Oh, let's still got quite a lot of time. The choriocarcinoma. Tumor composed of small round mononuclear cells with pale cytoplasm. Invasive tumor. So let's see where we can find good examples. Some good examples there. This tissue has been a bit overstained. Some examples here of pale cytoplasm there. Okay. Highly mitotic, yes, lots of mitosis, but abnormal mitosis. The smooth bundles of tissues is this area here, mitotic cells. Extensive necrosis with minimal trophoblastic tissue. This whole area here is necrosis, necrotic areas or tissue. It's dying away. So big spaces are forming and it's extensive, progressing everywhere throughout the tissue. It's a very good example of necrosis forming here inside the tissue mass. No villi are present. No villi. Necrosis has destroyed any examples of villi. This is a type of carcinoma that could well spread in the bloodstream as well. Here we can see disruptive cell division. He calls it variable atypia, which is abnormal cell division, yes. So apart from normal cells would have a round nucleus, these are elongated nuclei and they all seem to be elongated. Pleomorphism means the mass of them, there's lots of them up all over the place. Okay. There's not really any examples apart from this area. The tumor has really destroyed the rest of the normal tissue, massive necrosis everywhere. Extrauterine gravidity, tubal epithelium. Let's have a look. See, fairly normal epithelium there. Okay. Right, uniform structure. Very nice there. Placental villus, let's see if there's any disruption. Fairly normal, fairly uniform membrane, except for a little pocket there. There's no example of necrosis. So this villus is pretty healthy. Yeah, I'd say there's a pretty normal gravidity, if you like. So the placenta will obviously grow deep into the tissue and extract its blood supply from the mother's blood supply for the growing embryo. The placental villi on bloody background. These are the villi, nice uniform surface of epithelium. Notice just the mass of the villi is highly mitotic, lots of cytoplasmic space. The villi would require a lot of energy for their growth, but the membrane is the most important. The membrane is uniform around all the villi present. No example of necrosis or death. Okay. And the bloody background is all this, all the bloody areas. Very, very good slide. Nice contrast, if you like. Again, normal epithelial surface there. No examples of necrosis anyway. Lovely dividing and growing tissue that progressing as placental villi into the depth of the uterine tissue. Ovarian papillary carcinoma. He calls it branching papillae with marked cellular and atypia or nuclear or atypia. Where we have atypical nuclei, then you can think of perhaps a type of cancer. Also always see if you can look for some necrosis as well. Lots of branching occurring in this mass here. Now, all this here is blood, but this is the growth of this carcinoma or tumor. There are examples we can see of necrosis there. There's necrosis in it. So hence, this is definitely a rapidly growing invasive tumor. The nuclei would probably have to get a higher magnification to see. We can't really see the nuclei on this section. Yes. The nuclei are atypical. Yes, round nucleus, elongated nucleus. Fairly normal there. So here, disrupted, elongated nucleus, elongated nucleus, elongated nucleus. So there's some example. There's more examples of elongated nuclei than round nuclei. Definitely a sign of a type of tumor, or in this case, carcinoma. Papillary transitional cell carcinoma, multi-layered. Sure, it is multi-layered. It has 1, 2, 3 layers to its surface, and this means it's dividing rapidly and growing rapidly. Because it's growing so rapidly, it's forming channels, lots of surface or spaces, if you like, surface channels in its mass. Resembling urothelium. Yeah, urothelium is the tissue which has lots of spaces in it, urothelial spaces. It tends to look like urothelium because of the space. Papillary thyroid carcinoma, ground glass pale nuclei with nuclear grooves and vacuoles. Yeah, the ground glass pale nuclei tend to occur more in the thyroid. In this slide, however, we tend to have more of the normal darker stain nuclei. Okay. All right. Was your professor trying to contrast with the thyroid here? I think that's what I'm assuming. He's trying to contrast the two. I think, yeah. Is that what he's trying to do? Because this is ovary. It's not thyroid. This is ovary. This is the ovary. But I think what he's trying to do is trying to compare this with the thyroid. If you get us 2 slides, one of thyroid, look for nuclei that are kind of like pale, not purple stained. Fibrocytic breast disease. This is a definite example of a cyst, fluid-filled, hardened because of the fibrous tissue that's grown around it. The edge of the tissue is fairly smooth but highly divisive. It's dividing a lot. Okay, and growing a lot. There's another cyst forming here, smaller one. The fiber is trying to contain it. But of course, it grows in size, creates a lump eventually. This is not necessarily going to cause cancer, but a woman on feeling might assume it's cancer. As it grows in size, obviously it's going to push on normal lactating cells and ducts within the breast tissue. So that's, yeah, pretty good. The cyst is growing in size, if you like, cystically dilated duct. Fibrosis is now extensive. The disruption to the lactamal or milk-producing glands is beginning to become evident. Normally, you'd find lots of these all out or throughout the tissue, but you're getting the more of fiber forming, so isolating these areas. And this is why he calls it terminal lobular units. So units start to form on section of the tissue. That's a bit abnormal. Okay. They are rare. They're not normal. Rare. Adenosis can also be seen. Some with features of adenosis. Adenosis. Let's see if we can find adenosis. Here's examples of adenosis. More on this. Some examples up there. Adenosis is the round structures forming around this tissue. These roundish structures. Adenosis. That's kind of like a supportive cell, trying to support the isolated cells, if you like, but it's a bit abnormal because they're not normally that size. They're normally much smaller. These have grown in size. So the adenosis is quite evident. we move on,
Yeah.
breast disease, more fiber formed, lots of fiber, lots of luminal space, tissue, fluid forming in there, lots of nests here. Adenosis is there, round cells forming. Nice example there. So the lobular units are all over the place, but being replaced by fiber. Fiber is hyalinized because hyaline is protein. More protein, more fiber, more lumpy, like rough. Has a very extensive disease, huge lumens, very large lumens all over, nests, lots of hyalinized tissue, huge mass. The rest of the breast tissue has been disrupted in terms of its function, it's been replaced by hyaline. However, I cannot see examples of necrosis. Okay. Cystically dilated ducts, a very abnormal cell division there, although uniform border, big area of fluid formation. Very good examples of fibers, haline fibers, proteinaceous mass. The little cells here are dividing and metabolizing to reduce the haline fiber. Okay, over there. Eventually, this could potentially become carcinogenic, especially in the dividing cell area. Now we can see dilated ducts in the ducts everywhere, dilated and abnormal shapes. So the milk production properties have totally been lost in this slide. Huge masses of haline fibers. No examples of necrosis yet. The extensive rough and hyalinized fibrous stroma all over the place, very rough. The ducts are massive, very, very dilated, smaller ones forming, associated, as we've seen before in a previous slide. Lobular units all over, fairly uniform border. However, the pressure creates a lump in the breast, if you like. Infiltrated ductal carcinoma. So as I said before, this fluid-filled duct can, in this layer, become carcinogenic. Carcinoma of the breast is evident here because of the examples of necrosis. Now here we have a good example of necrosis here forming. Where you find necrosis, you tend to find darker areas and lots of little spaces, death of tissue, and then bigger spaces in the mass. And the disrupted cell division has caused a totally abnormal, generally abnormal tissue dynamic. Some remnants of haline fibers, so the haline fibers are being replaced by spaces as the tissue dies. This is the invasive tumor. Yeah, growing all around you. It becomes more and more invasive. It becomes invasive into the lactimal ducts of the breast and forms all sorts of patches of necrotic tissue, and you can see extensive necrosis throughout. Necrosis, 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 necrosis. As we move down, necrosis there. Invasive, abnormal, surrounded by some remnants of fiber. but succeeding in breaking through the fiber as it grows in size. Calcification can occur. Let's see if we can find some calcified deposits. Not so much evident here, more up here. Calcified mass is over here. Calcification is occurring around these darker areas. Good example of necrosis at the top right-hand side. Mitotic figures are often prominent. Disruptive mitosis. Yes, mitotic figures means disruptive cell division, if you like. Eosinophils. Eosinophils. Not really that clear. No, can't really see them that clearly. I think that's really, yeah. So yeah, highly invasive tumor disrupted all the function of the breast. Leukemia in the liver. Well, we've got some normal hepatocytic tissue, but here we have an invasive area. Infiltrates in the portal tracts, and as you can see, there's a lot of cell division happening here, and it's lymphocytic, lymphocytes, second defense of the white blood cells, and it's what's happening. Instead of them seeking out bacteria or viruses, they are instead damaging the normal dividing cells or hepatocytes, putting a rough sort of channel into the mass of the lobule and migrating through the hepatocytic spaces into the mass of the liver tissue. Here we can see a very good example of hepatocytes, lobule, normal lobule there, but this invasive area, Very good example of a lobule there, normal, healthy, but being impinged by a invasive infiltrate, which is eventually going to hit the central vein. And once the central vein goes, then the rest of the tissue is going to die, because the central vein provides nutrients to those dividing cells. It's spreading everywhere. You see the pockets there, the top there, they're all over, spreading there. So it's becoming tumors. At first it's not, but then it starts to become tumors. Eventually what's going to happen is you're going to find necrosis. And a lymph node follicular effacement by mature plasma cells with no rare lymphocytes. Okay. Let's see if we can find follicular here. Follicular structures there. Some follicular structures there. Little one there. Okay. Mature plasma cells. Looking for a nucleus, stained nucleus, probably there. There's a mature plasma cell there. I don't see a lot of them. You need probably another differential stain to pick them up, but there's one example there. This lymph gland has increased its metabolism to try and filter out the cancerous cells, and the liver is a gland with lots of lymph nodes in it. Example of a plasma cell there. The lymph node effacement is fairly evident by mature plasma cells. What that means is that the cells in the lymph node are starting to work a little bit harder than they normally would. And because they're dividing and metabolizing so much, they're creating these like channels, more channels. The effacement becomes more evident, if you like. Now these patches here are more capillaries, effacement. They're a nice example. There are lots of examples now of plasma cells all over the place. Now, that's of course part of your secondary defense mechanism. And they'll probably be recruited by a tumor necrosis factor secreted by the lymphocytes. Okay. So here we go. Some more examples. Plasma cells. Good examples of plasma cells in this high magnification. There's a good example of plasma cell there. And if you look more closely, you can see more. There's another one there. Another one there. Tend to be the larger ones with a more clearer cytoplasm. The lymph node with the darker cytoplasm is the normal tissue capillaries. They've been working really hard to try and deal with the tumor cells that are entering via the capillaries through the lymph nodes. So they're filtering out the tumor, destroying the tumor cells. Lots of Russell bodies in lymphocytes with no array. Sometimes you can find these in invasive lymphocytes. I can't see any invasive lymphocytes in this slide. No, I can just see the plasma cells. And I cannot see any macrophages either. Okay. Yes, I think we're coming towards the end. Hodgkin lymphoma of the hour.
That's fine. That's fine.
So
Just if you could just send the recording.
send you the recording, no problem. Okay. All right. Do you have any
For
questions?
now, then this is the last lesson, and then if you need any help, I've got your email address. So I can contact you by that.
Yes.
Is that fine?
Yes. I could also send you my mobile phone if you want to text me for a last lesson, if that's okay as well.
Yeah, you can just will you send it by email or
By email, yeah.
email, yeah. For now, like this is the last lesson until the exam, and then it depends on how the exam goes. And
Okay.
then me and my father will decide.
Okay. Well, I wish you the good luck. I think you'll do well. I think you'll do well. Yeah. I think. Yeah. Very
Thank
good
you.
luck. Yeah. Nice to have taught you. So
And
yeah.
on Tutor Hunt, will you also change it as the last lesson, so you don't take more
Okay.
money?
Yeah. I changed to the last lesson. Yeah. All right. But if you need another one, just text me and then we can easily put a one off. Yeah.
Yeah. If you could just email me your phone number, then
Okay. All right. All the best.
thank
Take
you so
care.
much. Thank you for teaching. Thank you.
Bye.
Bye.